So what do women really ask, right? Is menopause gonna suck for the rest of my life? Is this what aging feels like? Is this the onset of dementia? Am I gonna enjoy sex again? Why hasn't anyone told me much about menopause at all? Hi, I'm Dr. June Sheren. I'm a family physician or primary care physician. I look after women through their life stages from adolescence through the reproductive stage through menopause. So it encompasses all aspects of health and well-being for women. Menopause is defined when a woman goes 12 months without a menstrual period. And for the majority of women, that occurs between the ages 45 and 55. Peri is Greek for around or near. So perimenopause means around or near the time of menopause. And the stage of perimenopause can start 10 years before a woman reaches menopause. Post-menopause refers to the time after the final menstrual period, so after menopause. Let's answer some common questions about menopause. Do all women need HRT? HRT is outdated. Nowadays, we call it menopausal hormone therapy or MHT. Not all women need to take MHT, but MHT is indicated and useful for women who are experiencing symptoms, and it is also useful for the prevention of osteoporosis in women who might be at risk. Are all hot flashes the same? Typically, hot flashes are described as starting from the top of the upper body and rising into the face and the head. But some women may just feel intense heat throughout the body. They might feel hot all the time. They could also feel very cold. They could experience chills. And some women may experience pangs or waves of anxiety, palpitations, and their heart racing as well. So every woman experiences hot flashes and sweats, what we call vasomotor symptoms, differently. Do Asian women also experience menopause? This is a bit of a myth, isn't it? There have been past studies that have found that the experience of Asian women through menopause is not hot flashes or night sweats. Current studies, including studies in Singapore, show that women can experience a whole range of different menopausal symptoms, and certainly Asian women do suffer from menopause. Does your voice change during menopause? The most dramatic voice change in males occurs in puberty. For women, that occurs during perimenopause. And menopause, there are strong hormonal influences on voice, include perimenopausal voice changes such as vocal fatigue, dryness, hoarseness, a reduction in projection, and several other different changes. Does menopause affect ADHD? The answer is yes. Estrogen decline affects women with ADHD. About 40 to 60% of women experience cognitive change like forgetfulness, brain fog, mood swings, insomnia. Throw in the sleep disturbances, anxiety, and sometimes depression. All of that can certainly worsen ADHD in women who have it. Next question. Can menopause treatment last forever? Well, the guidelines currently say that menopausal hormone therapy can be continued in women who continue to need them. And indeed, some women continue to have symptoms beyond the age of 60. There is a need for continual assessment, weighing risks and benefits, and that's best determined collaborating with a doctor. We know that most menopausal symptoms will resolve over time, and so treatment is not likely to be needed forever. These are questions that I get every single day from my patients. Not every woman who comes to see me has physical symptoms, but just about everyone has been impacted psychologically. Many of them will express how they have been impacted by sleeplessness, anxiety, and many also express a sense of loss. The menopause transition can be a very challenging time for many women. If you need professional professional help, there are safe and effective evidence-based treatment options in order to thrive through the change. Speak to a doctor who's knowledgeable in this field and who is willing to listen to your concerns.